Hello, this is my head to toe assessment video. First I'm going to start by doing the mirror scan. Alright, hello. Hi, my name is Leela. I'm going to be your nurse practitioner today. We're going to be doing a full head to toe assessment. So first I'm going to start off by saying that I have washed my hands for proper hygiene, and I am providing patient privacy with this door and also with this towel as a curtain for when the patient needs a change. So I'm going to start with your vital signs. So can you tell me your height and weight?
125, my weight, and my height is 5'6".
Okay, very good. So I calculated your BMI already, and it's 19.4 kilograms, which falls within the normal range. Your blood pressure was 115/75, and your heart rate is 82, which are all normal findings. So I'm going to start by asking you what brings you in today.
I'm just 2 years ago, when I was doing exercise, I did something to my back. I hurt my back, and there's a pain in my lower back that it just comes and goes and gets aggravated. So right now it's just I'm having a little bit of lower back pain.
Okay. And have you been taking anything to alleviate the pain at all, or doing any exercises or?
Not necessarily. No, I do normal yoga, Pilates, walking, but sometimes when it hurts a lot, I just take some Advil and Tylenol, like alternate dose. That's it.
Okay. And have you seen any other provider for this in the past?
Yes, I've seen back specialists in the past, and there's nothing they can do, but it just gets. But it's not a consistent pain.
Okay. All right. Do you take any other medications besides ibuprofen for the pain?
No.
Okay. Any daily medications?
I take daily supplements, my vitamins, minerals. I take multivitamins. I take vitamin D, magnesium, vitamin B complex, and I take Adderall, prescriptive Adderall daily.
Any present or past medical health history that you want me to be aware of?
No.
Okay, very good. All right, so now I'm going to start with the skin assessment, okay? So just looking at your skin overall from what I can see with the gown on, the skin color is pink. I'm going to palpate for texture, for temperature, and any moisture, okay? So if I could just see your arm for as an example. Okay, so the texture is normal, the temperature is a normal temp. There is no excessive moisture, and her skin turgor is normal as well. I don't see any lesions present, but I will make note as we go along through the assessment. If I could see your hands, look at your nails, please. Okay, so I'm going to do the capillary refill, which is a little difficult to do because she has nail polish on, but normal capillary refill findings would be expected on this patient. The nails are in good hygiene, and they're in good shape and symmetrical. There are no lesions present, and the nail angle is about 160 degrees. I'm going to move on to your head and face now. So looking at your head, the shape and size are symmetrical bilaterally. The scalp I'm going to take a look at, which is white. I don't see any presence of dandruff or any flaking or any excessive dryness. The hair is a brown color, and the texture is coarse, and it's distributed evenly along the scalp, and no alopecia is seen, and it's well maintained. Looking at your face, facial symmetry, can you puff out your cheeks for me? Very good. Okay, stop, smile, frown, show your teeth, okay, and then close your eyes. Okay. So that's testing cranial nerve number 7, which is intact. Doing cranial nerve number 5 now. I'm going to palpate your masseter muscle. So if you could just clench your jaw. Okay, that's symmetrical bending there. Okay, so now I'm going to palpate the sinuses. So just let me know if there's any pain or discomfort. This is the maxillary. This is maxillary. So any pain there?
No.
Okay,
No.
okay, now I'm going to do the trigeminal assessment. So I'm just going to be testing the sensory function of cranial nerve number 7. So I'm going to just lightly like brush my finger over different areas of your face. Let me know where you feel it, okay? Close your eyes.
No, it's left. No, I'm sorry, right temple.
Okay.
Left cheek. Right jaw, chin.
Okay. Okay, so that means that cranial nerve number 7 is intact. I'm going to move on to your lymph nodes now. So normal findings would be that there's no enlargement and they are small movable masses. Okay, so I'm going to start with the occipital. Postervicular. Preorbicular. Submandibular. Segmental. Anterior cervical. So I'm doing this first superficially, and then deeper. Any pain there?
No.
Okay, and then posterior cervical. And then we do the supraclavicular, so if you could shrug your shoulders up. Okay, very good. Moving on to the eyes now. So I'm looking at the symmetry of the eyes. They are symmetrical and normal. The brows are also symmetrical, and the hair is an even hair growth. The lashes are everted. I'm going to pull down on your lower lid to take a look at your conjunctiva. So open your eyes. Okay, and it's pink bilaterally, which is a normal finding. Sclera is white. Looking at this from the side now. Okay, good. So from the side, the cornea is clear. There is no evidence of scarring, of arcus or clouding. Okay, so I'm going to look at your pupils now with my scope. Just look straight. Okay, here we go. So I would say that the pupils are size 4 and they're equal. When I checked for light reaction, they constricted to about 2 millimeters. I'm going to do a test for cranial nerve number 2 now, which tests visual acuity, and we're going to be using the Snellen test. So could you just, oh, I'm sorry first. Are you wearing any corrective lenses?
No.
Okay, great. So I'm going to hold this about 14 inches away from your face, and I want you to read the smallest line you can.
DEFPOTEC.
And I would do that with her eyes uncovered, and then one eye, and then the other eye as well. But for time's sake, we won't do that. Okay, so now we're going to test cranial nerve number 3 for convergence. So I'm going to ask you to follow my finger, starting from here, all the way to the bridge of your nose. Okay, so the pupils converged, they are constricted, which means that cranial nerve number 3 is intact. Next, I'm going to test the corneal light reflex. I'm going to get my scope again. Okay, so I'm going to just look with the light. Okay, so they are symmetrical and cranial nerve number 5 is intact. Now I'm going to do the cover-uncover test. So hold this in front of your eye. And the other eye. Very good. Okay, so the pupil maintains a midline position and there's no deviation. Now we're going to do the visual field with confrontation. So hold this again, cover up one eye. And I'm going to ask you to tell me how many fingers I'm holding up in different locations, okay?
2, 4, 1, 3.
And we do that in the other eye as well. Now I'm going to assess for the red reflex. So I'm going to shine the light about 10 feet away approximately. That's right. So the normal finding is an orange glow to the pupil. The optic fundus now I'm going to test, which I'm going to move in a little closer. Okay, so the optic disc is on the nasal aspect. The macula is on the temporal aspect. The arteries and the veins are both seen in the eyes, and there's about a 2-3 ratio between them. And then I'm also going to test for color blindness now using the Ishihara eye chart, so which I have here. So I'm going to ask you to, what is the first number that you see here?
74.
Okay, and how about there?
12.
Very good. All right, now I'm going to move on to your ears. So if you could just pull your hair up for me. Okay, so looking at the external ear, it's symmetrical, the skin is in good condition, there's no dryness, or any drainage or fluid coming out. I'm going to pinch your ear now. Let me know if you feel any discomfort. Any discomfort?
No.
Okay. So I'm going to assess cranial nerve number 8 now for acoustic nerve. So I'm going to ask you to cover one ear. I'm going to whisper a sentence in your ear and tell me what I said, okay?
Okay. The duck is yellow.
Very good. And I would do that on both sides to test for symmetry. I'm going to do the Weber test now, which also tests cranial nerve number 8. So I'm going to take this tuning fork. I'm going to strike it on my palm, and then I'm going to place it in the center of your forehead. I want you to tell me if the sound and vibration are equal in both ears or not, okay?
Yeah, it is.
And then that means that there's no lateralization. I'm going to test the Ryan test now, which also tests cranial nerve number 8. So same thing, I'm going to just strike this, I'm going to place it behind the back of your ear. I want you to tell me when you no longer feel the vibration, okay?
It stops.
Okay. So that just shows that, which is a normal finding, with that air conduction is longer than bone conduction. I'm going to palpate your mastoid and tragus now. Any pain here?
No.
Very good. I'm going to inspect the ear canal and the eardrum with my scope now. So the ear canal is pink and patent, which is a normal finding. The tympanic membrane is also looked at when I looked at it with the scope. It was flat, clear, and translucent. I saw the handle of malleus and the light reflex at 5 o'clock, and there was no redness, no bulging, or any fluid in the tympanic membrane. I'm going to move on to the mouth now. So I'm going to assess your lips. So they are pink and moist, and they are symmetrical. I don't see any dryness or cyanosis. And then, can I see your teeth? Show me your teeth. Okay. They're in good condition. I don't see any dental caries, and I'm going to put on some gloves now. Okay, so I'm gonna have you stick out your tongue for me. Okay, very good. So the tongue is midline. I see the papillations on the tongue. There's a slight white coating to the tongue. And I'm gonna have you just, I'm gonna put my hand on your cheek. I'm gonna have you just press your tongue against the cheek, okay? Very good. So there's good strength there. And I'm going to inspect your mucous membrane. So if you could stick out your tongue again for me. Okay, good. So, so the buccal mucosa is pink and moist. The Stetson's duct was seen across from the second molar, and the Wharton's duct is underneath the tongue. Can you stick out your tongue and say ah? So the uvula is midline and symmetrical. Both the hard and soft palates are also there, and they are symmetric, which tests for cranial nerve number 9 and 10, which is intact. Your tonsils, which I saw, I haven't seen yet, so I'm going to just have you say ah again. So the tonsils are a size 3. There's no exudate, redness, swelling, or tonsillar stone seen, which is normal, and the posterior pharynx is pink and moist as well. I didn't see any lesions on the sides of the tongues, and I'm not going to do it for this test, but to test the gag reflex would be testing cranial nerve number 10. Okay? We're going to move on to the neck now. So looking at the neck, it's symmetrical. The skin is pink and intact. I don't see any tracheal deviation. It's midline, so I'm going to just palpate. And I'm going to palpate the carotid pulses as well. So +2 bilaterally. I'm going to just have you turn to the side for me. And I'm going to palpate the thyroid here. I'm going to ask you to swallow. So the thyroid glands move up and down while the patient's swallowing, and there's no enlargement or nodules. You can turn back to me. So I'm going to move on to the nose now. So the nose is symmetrical. The skin is in good condition as well. So I'm going to have you cover one nostril at a time, and breathe in and out. And same thing on the other side. Any difficulty breathing there?
No.
Okay, very good. So that just shows that the nostrils and the nares are patent. I'm going to do the smell test now, which tests for cranial nerve number 1. So I'm going to have you close your eyes and I'm going to have you smell something and you just tell me what that smell is, okay? I'm going to grab something and close your eyes and smell.
Alcohol.
Very good. Okay, you can open your eyes. I'm going to use the otoscope now to assess the inside of the nose. Very good. So the septum is midline, there's no deviation there. The turbinates are small and pink. There's no drainage noted, and the cilia is noted along the nares as well. No lesions, edema, or discharge either. Okay? And I'm going to assess your neck. So we're going to assess the T and J. So if you could just open and close your jaw a few times. So there's no crepitus or crackling there. I'm going to assess the cervical spine. So if you could just move your head up and down, and then left, not like this, and right. Very good. Any discomfort there?
No.
Okay, very good. So that just shows that you have full range of motion. I'm gonna just have you turn to the side again. And I'm gonna palpate down the spine. Is there any discomfort here?
No.
Okay. And then I'm gonna palpate the paravertebral muscles as well. Any discomfort?
No.
All right, turn back towards me then. I'm gonna be testing for cranial nerve number 11 now. So I'm gonna have you just turn your head against my hand when I place it, okay? And then show your shoulders for me. Very good. All right, I'm going to listen to the carotids now. So I'm going to have you breathe in and out, and then when you're exhaling, just hold it, okay? So, and then just looking at the jugular vein, I don't see any distension either, which is a normal finding. Okay, so that completes the HEENT portion of the exam. So now we're going to move on to the RCAT-SEN portion, okay? So then I'm going to start with testing your mental status, okay? So I just have some questions for you just to test mental status. So where are we currently?
We are in New York City.
Okay. And what year is it?
2025.
Okay. And then who's the president?
Donald Trump.
Okay. And then what time is it about approximately?
2:30.
I'm going to ask you some questions now to test for cognitive function, abstract reasoning, and judgment. The first question is, if you were to find a stamped envelope outside on the ground, what would you do?
No, try to take it to a post office.
So that shows
Post
that your
office box.
okay. So that shows that your judgment is intact. How are an apple and an orange similar?
They're both around the spheres.
Okay. And how are they different?
One is orange, thicker skin. The other one is red or yellow.
And then lastly, to test your cognitive function, I'm going to ask you to start from 100 and count down by 7.
Okay, 100, 93, 80, 86, 79, 72, 60, 65.
Okay, that's fine. You're good. Okay. Very good. And then I'm going to test your recent memory. So I'm going to ask you to remember 3 words: apple, penny, and table. Okay. I'm going to ask you these later on in the exam. Try to remember them. Okay. Okay. So now I'm going to start by looking at. We're going to start the physical exam now. So I'm going to start by looking at your chest. So if you could just pull this down a little bit for me. So looking at the chest, it's symmetrical bilaterally. There's no sign of trauma or lesions. The skin is dry, clean, and intact. There's no signs of retractions or use of accessory muscles when breathing. And you're also negative for any signs of respiratory distress. Okay, and also your respirations are easy and regular as well. I'm gonna have you turn to the side for me. Okay, so I'm gonna just start by looking at the back posterior chest. So the back is midline. I'm sorry, it's not. It's the skull structure is symmetrical bilaterally, and I'm just going to palpate along your back now. Let me know if you feel any discomfort. Okay. Any discomfort there?
No, no discomfort.
Any tenderness at all?
No.
Okay, so there's no tenderness and no crepitus felt, which is normal. I'm going to check for chest expansion now. So I'm just going to have you breathe deeply in and out. Again. Very good. So there's symmetrical rise and fall with the chest there on inhaling and exhaling. Now I'm going to test for tactile fremitus. So I'm going to, again, I'm going to palpate along your back, and I'm going to have you say, just say 99 every time, okay?
99, 99, 99, 99, 99, 99.
Okay. So when palpating there's a slight vibration at the top of the back bilaterally, and that vibration gets a little bit less noticeable as I go down the lung fields down the back. I'm going to percuss the lung fields now, okay? Okay, a resonant tone is heard there. I'm going to test for diaphragmatic excursion now. So I'm going to percuss as you inhale and hold it, okay? Okay, go ahead. Okay, that's good. Okay, inhale again. Okay, very good. All right, so I'm going to just take pen. And note that this is the point here on the back. Okay. So when exhaling, the diaphragm moves up because the air is moving out of the lungs, and the distance between those 2 points was about 5 centimeters. I'm going to listen to your respirations now. All right, so just inhale and just breathe normally. Okay. So the region on the lower right-hand side here indicates sounds from the right middle lobe. The top middle up here is bronchovesicular sounds, and then the remainder of the lung sounds or vesicular sounds that are heard that are soft, lower pitched, and the inspiration is greater than the expiration. I'm going to assess for epiphony now. So I'm going to ask you to say E every time I move my stethoscope, okay?
E, 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 E.
Very good. So the E sounds muffled, which is negative for consolidation. I'm going to assess for bronchophony now. So I'm going to ask you to say 99 again with each movement of my stethoscope.
99, 99, 99, 99, 99, 99, 99.
Okay. So every time she says 99, it is quiet and muffled, not pronounced and loud, which would be positive for consolidation. Okay, so you can move back towards the front now. Okay. So I'm just looking at, oh, actually, I'm going to have you stand up and move the gown to the front for me now. And so now I'm looking at the anterior chest, inspecting this. Okay, so there's no obvious deformities, trauma, or lesions. The anterior to posterior chest is about a 1-to-2 ratio, with no evidence of barrel chest. The chest is symmetrical bilaterally, and her respirations are clear, and I don't see any signs of distress. I'm going to palpate now, and I'm going to ask if there's any discomfort. Okay.
No.
discomfort?
No.
Okay, so now we're gonna do the same thing that we did on the back, where I'm gonna have you say 99 every time to check for chest expansion.
99, 99, 99, 99.
Very good. So there's equal rise and fall with each movement, and it's bilateral. All right, I'm going to listen to your breath sounds again on the front side. Just breathe normally. So the lung sounds are clear bilaterally. There's no evidence of any bronchi or rales. Here in the right middle lobe is the right middle side is the right middle lobe, and then the top middle is the bronchial sounds that are louder and harsher. I'm going to move on to the cardiac assessment now. So just looking at your chest once again, there's no evidence of any lifts or heaves when assessing the chest. I'm going to palpate each point of the cardiac boundary. So we're going to do this right second intercostal space, which is the aortic. The left side is the pulmonic. Left third intercostal space is Erb's point. Left fourth intercostal space is the tricuspid area. And the left fifth intercostal space is the mitral area, which is also the point of maximum impulse. It's negative for any pulsations or thrills. I'm going to listen now with my stethoscope, and I'm going to listen with both sides, the diaphragm and the bell. So starting over here again, in the aortic. So S1 is less than S2. Over here, the pulmonic, same thing, S1 is less than S2. Moving down to Erb's point, S1 and S2 are the same. Tricuspid area, S1 is greater than S2, and then in the mitral area, S1 is greater than S2. And then same thing with the bell. So S2 is louder than S1 here. The pulmonic area, S2 is louder than S1. In the Erb's point, S1 and S2 are the same. And then in the tricuspid, S1 is louder than S2. And in the mitral area, S1 is louder than S2. Okay, so now I'm going to just have you sit up and lean forward. No,
Sit up?
Just lean forward.
Oh.
Not all the way. Just a little bit. I'm going to be listening in the aortic area, and I'm listening for an aortic murmur. Okay, good. Okay. And now I'm going to just have you turn to the side a little bit, and I'm going to listen for a mitral murmur now. Oh, I'm sorry. Actually, the aortic murmur would have been up here on the right intercostal space, but the mitral murmur would be listened here. So, listen for the aortic murmur. So that's right, slightly forward a little bit. No murmur here. In the mitral area, there's also no murmur heard. There's also no presence of any extra heart sounds such as S3 or S4. Okay, so now I'm going to do the inspection of the abdomen. So you can just, I'm going to have you lay down on the bed completely. Right. This is so tight. Okay, so we're going to be doing the inspection of the abdomen now. So just looking at the abdomen, is there any discomfort at all?
No, not momentarily.
So the skin is pink, and skin is intact, and there's it's negative for any scars or lesions. There's no obvious bulging or masses either. The umbilicus is inverted, and there are no dilated vascular patterns or ascites noted either. I'm going to listen now with my stethoscope. So starting in the right lower quadrant. So there are clicks and gurgles heard. Okay, so the vowel sounds are heard in all 4 quadrants there. And now I'm going to listen for any vascular sounds just below the xiphoid process. And I'm listening for aortic bruits as well, with both the diaphragm and the bell. And there are no bruits heard. Listening for the renal arteries now, with both diaphragm and bell. And there are no bruits heard bilaterally. Okay, so now I'm going to palpate. Anything? All right, and there's a slight pulsation felt bilaterally, and the distance between my 2 fingers is about 2 centimeters, which is normal. And then there's no evidence of a dilated aorta as well. I'm going to do percussion, so I'm going to do this so that because there are different, all around the abdomen there are different tones heard, okay? Okay, so tympany is heard where there's air in the abdomen, whereas there may be dullness heard in areas where there's like an organ or stool. Okay, I'm going to percuss for the spleen now, which is on the left costal margin, and there's a dullness heard over the spleen. Yes. All right, I'm going to percuss over the gastric bubble, and there's a dull sound heard. I'm going to percuss for the span of the liver now. So I'm going to start here. So I'm going to start where the dullness started. Okay, so the distance between these 2 spots is about 8 centimeters, which is a normal finding, and that's the span of the liver. Okay, now I'm going to palpate the abdomen, okay? So just let me know if there's any pain, okay? I'm going to start with a light palpation. And then I'm going to do deep. Okay. No. Okay, now I'm going to start palpating for your spleen, so I'm going to start the middle left side. Near the umbilical, and then I'm going to move towards the left costal margin, okay? And there's no enlargement of the spleen felt. I'm going to palpate for the liver now, so I'm going to be using the hook method over the middle right side of the umbilical. And I'm going to ask you just to take 2 deep breaths while I'm pushing down. Again. There's no enlarged liver felt, and it's felt under the costal margin. Okay, so now I'm going to palpate for the appendix. Actually, have you just move down a little bit for me, just because your head is getting cut off. Is it more comfortable? Okay, so now I'm going to be palpating for the appendix now. So, testing for rebound tenderness. So I'm going to push down on your right lower quadrant, and then when I release, I want you to let me know if there's any pain, okay? Pushing down, and any pain? No. Very good. All right, so now we're going to test for psoas sign, which is another test for appendicitis. So I'm going to push my hand down on your right thigh, and then I'm going to have you move up your leg, okay? Good. Move up your leg.
Move it?
Any pain there?
No.
Okay, very good. And then we're going to be testing for obturator sign now. So bend your right knee for me. and then rotate your lower leg. Any discomfort there in the right lower side here?
No.
Okay, good. You can put your thing in. Okay, so now I'm going to be palpating for your inguinal lymph nodes. Normally we would do this right on the skin, but for sake of the patient's privacy, I'll just do it over her clothes. Any pain here? No. Okay, great. Okay, now I'm going to do the vascular assessment while you're still laying down. Oh yeah, I forgot to do the kidney. I'm going to have you just turn onto your side for me. I'm just going to palpate along here for the kidney. Any pain or discomfort here?
No.
Okay. There's no tenderness and no pain and no enlargement of the kidney either, which is normal finding. Lay back on your back. So now we're going to move on to the vascular assessment. So inspecting, actually I need you to take your pants off. So just, it's not cold. Okay. And then move the gown to the front. Very fun. Like turn the gown around. It is, sorry. It's already. Just close the gown. Warm. Alright. So now we're going to be doing the vascular assessment. So I'm going to be inspecting your lower extremities. So they don't, I'm just looking at them, they don't show any signs of arterial insufficiency and bilaterally. And there's also no edema along the calves as well, the shins, when pressing down. And the skin color is pink and warm and dry, and the temperature is normal, and there's no excessive moisture there either. I'm going to do the Berger's test now. So I'm going to just have you raise your lower leg.
Which one?
Whichever one. Okay, very good. So I would say that I would actually going to do that test again because I didn't do it correctly. So I'm going to have you actually raise your leg and then rotate your ankle. And we're allowing the blood to drain completely. Good. So we would allow for that. So when I have the patient sit up now, the color should return in about 10 seconds. And that means that there's no signs of insufficiency in the lower legs. Okay, so I'm gonna have you sit up now. And just scoot a little bit more. Okay, so looking at the upper arms here for the upper vascular assessment, the arms are pink, warm, and intact bilaterally. I'm going to assess the pulses now. So if I could see your wrist, this is the radial pulse. So it's about a +2 and strong. The brachial pulse here, +2 and strong. I'm going to assess the popliteal pulse now. There's about a +1. I'm going to be doing the pedal pulses too now, which is at the top of the feet. About a +2 bilaterally, and then the posterior tibial pulse, which is a +2 bilaterally. So now I'm going to have you lift your leg towards your nose and pull your toes up. Any pain there?
No.
Okay, push your toes down. So that's a negative Hohmann's sign, which is normal, with no calf pain. Okay? Okay, so now I'm going to have you, we're going to do the Allen test. So I'm going to test for blood flow in the wrists and hands. So I'm going to have you start with your radial pulses and make a tight fist. Okay, and then open your hand. Okay, very good. And I'm going to do this again. I'm going to put pressure on your ulnar and radial pulses. So I'll do it again, tight fist. And I'm going to release on the ulnar side and release. Okay, very good. So the pink color returns to normal when the pressure is released, which indicates a good blood flow. And same thing when I wasn't holding pressure on either pulse. All right, so now I'm going to do the reflexes. So I'm going to be using the reflex hammer. I have my reflex hammer here, and this is used to elicit a contraction. So I'm going to start with the radial pulse. So we're starting from this bony nodule here and moving 2 to 3 centimeters down. And when I do it, the hand should like move out a little bit, like for supination. Okay, great. Now I'm going to do the brachial pulse. So I'm going to have you just hold your arm up like this. Feel for it here. Same thing. This is going to look for the bicep contraction. Good. All right. Then we're going to do the patellar reflex. So I'm going to move the camera down just a little bit. Okay. Same thing here. You can put this right here. Okay. And then I'm going to have you just swing your legs up here again for me. And I'm going to do the Babinski reflex on the bottom of your foot.
Swing what?
Just like lay your legs out again.
Lay down.
Okay, so alright, so this is the Babinski reflex, so I'm just going to just pull your foot up. So there was no flaring of the toes, which is a normal and negative Babinski reflex there. Okay, so now we can sit up for me. Okay, so now we're going to be doing assessment for carpal tunnel. So I want you to hold the backs of your hands together like this. And you would do this for about 60 seconds, but for the purpose of this test, I'm not going to have you do that. Any pain or discomfort there?
No.
Okay, release. Any pain or discomfort?
No.
Okay, very good. And then I'm going to assess the median nerve, so if I could just see your wrist from you. So I'm just going to tap on your pulse rapidly. You let me know if there's any pain or tingling. Any pain or tingling?
No.
Very good. All right, now we're going to move on to the musculoskeletal assessment. So this is for the upper extremities. So I'm looking at your hands. I don't see any nodules, edema, or redness. I'm going to have you test your range of motion now, and this is going to be for the hands first. So form a fist, and open, spread your fingers wide, and then bring them together, and then touch your thumb to each finger. Okay, so there's good range of motion in the hands. Now for the wrists, flex your wrists down, and up, in, and then out, and then rotate your wrists. Very good. And then I want you to squeeze my fingers. Squeeze. Okay, grips are about 5+ strength. Release. And then push against my hands. Push. Okay. And then strength of the hands is 5+ too. Now for the elbows, there's no redness or swelling or crepitus seen in the elbows. So I need you to flex and extend your elbows. So flex and then extend. All right. And then I'm going to apply pressure, and I want you to just press against. Very good. Okay. And that would be bilaterally. Now for the shoulders, I don't see any redness or swelling in the shoulders. I want you to now flex or raise your arms all the way up, and then extend down, and then hyperextend, so arms behind you, and then abduct, so arms away from the body, and then adduct to bring the arms to the body. Okay, and then I'm going to apply pressure. Release, just relax. And I'm going to have you push your straight arm against my hand when I press. Okay, so hold your arm out like this. Straight, and then push your arm against me, and then in. Okay, very good. A good range of motion, and this muscle strength is a 5+. All right, so I'm gonna have you lay back down again. Okay, so now I'm gonna move down to your toes. So can I have you actually take your socks off for me? You can just do it one time. Okay, so looking at the toes, I don't see any, let me just stand here. So looking at the toes, I don't see any edema, any redness, any swelling at all. I'm gonna have you do the same thing that I did with the upper extremities. So flex your toes. Okay, and then flex them up and down. Okay, and then rotate them. Okay, very good. And then adduct, so bring them out wide. And then together adduct, okay? And then I'm gonna ask you to close your eye. I'm gonna come down, I'm gonna move your big toe up or down, and I want you to be able to tell me which position it's in, okay? Close your eye.
Down. Up.
Okay, so now we're gonna move on to the ankles. So same thing, flex your ankle down, and then up. And then move the sole of the foot inward, and outward. Okay. I'm gonna push your foot up and down against resistance. Okay. So push down. Okay, and then upward. Very good. So muscle strength is about a 5+ there too, bilaterally. So same thing with the knees now. So I'm gonna have you bend the knee and then extend out, and then I'm gonna just have you push against my hand again. So very good, and very good. Okay, 5+ strength in the knees. Now hips. So same thing here. So there's no redness or swelling in the hips. I'm going to have you just raise your legs straight up and down. Okay, good. Down. Very good. And then adduct. And then abduct, sorry, then adduct. Very good. All right, and then same thing, push against my hand. Very good. Okay. So now you can sit back up. Okay. So now I'm going to have you stand. So we earlier we did the sign for the varicose veins, and we would just wait to see 20-30 seconds to see if any varicose veins develop now that the patient is in the dependent position. But there aren't, so she's negative for varicosities. Okay, so I'm going to stand over here, and I'm going to do a spine assessment now. So just turn that way for me. Okay, so I'm just going to feel around your spine. You just let me know if there's any pain or discomfort. Okay. No. Okay. There's no pain or discomfort in the spinal region, which is normal. The spine is midline, and there's no signs of scoliosis, lordosis, or kyphosis. We're going to test for range of motion now. So if you could bend forward as much as comfortable. Okay, very good. Spine is midline, no curvature of the spine, and showing good range of motion. And then if you could bend to the right and to the left, and then just rotate. Okay, very good. Okay. And there's good range of motion there too. All right, so you can turn back towards me. So I'm going to ask you if you could identify those 3 words that I asked for recent memory. Can you remember them?
Penny, apple, table.
Very good. So now we're going to do a gait assessment. So I'm going to just move the camera back so I can have you walk. Like 6 to 7 steps. Actually walk like this. That way. So, okay, very good. So, and then walk back. Very good. Have you do a different type of walk. So walk on your tiptoes, looking for balance here. Okay, then walk back on your heels. Okay, very good. And that's normal. And then walk heel to toe. And this is called tandem walking. Like, yeah. Heel to toe. Very good. So overall, the gait is steady. Her arms swing in opposition when she walks. The tandem walking is normal. Now I'm going to do the Romberg test. So I'm going to have you just close your eyes while standing, and then see if you lose your balance. So that's normal. There's no abnormal movements or swaying. So you can open your eyes now. All right, you can have a seat. All right, so now I'm going to do the sensory assessment. So I'm going to use this little, move this back. Okay. So I'm going to use this little thing here. I'm going to just have you do a sharp and soft assessment test. I'm going to have you close your eyes, and you just let me know if it's soft or sharp that I'm touching you with and where. Okay? Close your eyes.
It's soft.
And where?
In my right cheek. It's sharp and it's on my left temple. Sharp on the lower chin on the right side.
Okay, very good. And then I'm going to do the lower assessment too.
It's soft on my right knee.
Okay.
Sharp on the top of my left foot.
Okay, now I'm going to do the tuning fork test again.
Should I have my eyes closed?
No, you open your eyes. So I'm going to strike the fork, and I'm going to have you just tell me when you feel it placed close to the skin, okay?
I feel it. Yeah, I feel it.
Very good. Now I'm going to do the sterignosis test. So I'm going to place something in your hand and I'm going to just ask you to identify it, okay? Close your eyes. Can you tell me what this is?
It's my AirPod case.
Okay. Now I'm going to do the graphesthesia test. So I'm going to write something in your palm and I want you to tell me what it is.
8.
Very good. Okay. All right. And that's the end of the assessment.
Oh, okay.
All right. Thank you for your cooperation.